Hello doctors. Today let's talk about the topic cell death. Let's see more of exam oriented points and I'll teach you how to solve questions on this topic. Usually the cell undergoes death by any of this type. It could be necrosis, apoptosis, necroptosis, pyroptosis or anoikis. Now let's see what do they mean. First, let's talk about necrosis. Whenever there is necrosis, there is inflammation present. There are many types of necrosis. The first type is coagulative necrosis. This is the most common type of necrosis, usually seen in heart, liver, and kidney. So, if the examiner mentions any of the organ, you could think about coagulative necrosis. The second type is liquefactive necrosis. It involves organs like brain and pancreas. Then caseous necrosis, which is a combination of coagulative necrosis plus liquefactive necrosis. This is usually seen in organs affected by TB, histoplasma, coccidiomycosis. Then fat necrosis, usually seen in fatty structures like breast and omentum. Then fibrinoid necrosis, seen in polyarteritis nodosa, vasculitis, rheumatic heart disease, and malignant hypertension. Now, I'll tell you the keywords to just straight away answer the question. These are like the buzzwords for this topic. For example, whenever you see a solid organ mentioned, like heart, liver, or kidney, most probably it can be a coagulative necrosis. If the examiner gives abscess in the question, it could be liquefactive necrosis. Or if you see cheesy appearance in the question, it can be caseous necrosis. If you see some fatty structures like breast or omentum, the examiner is asking you about fat necrosis. Then, when you see some antigen antibody reaction in the question, that can be fibrinoid necrosis. This antigen antibody complex goes and deposits in few structures and causes inflammation, causing fibrinoid necrosis. Next, let's talk about apoptosis. Now, if you see, apoptosis does not involve inflammation, but we just saw that necrosis there is inflammation present, but in apoptosis there is no inflammation. Also, apoptosis is an active process. Remember, A for apoptosis, A for active process. Now, apoptosis is done by two steps. It is first initiated, then it is executed. Apoptosis, we all know that it's programmed cell death, but the main point is it is caspase dependent programmed cell death. Now, what do you mean by caspases? Caspases are some enzymes that break the cell and cause cell death. Now, let's see the processes. First, apoptosis is initiated. It is in the initiation step, the caspases 8, 10, and 9 are activated. This is done by two pathways. The extrinsic pathway activates caspase 8 and 10. The intrinsic pathway activates caspase 9. These caspases then activate caspase 3, 6, 7. Remember guys, for apoptosis, first it is initiated, then it is executed. For initiation, we need to activate caspase 8, 10 and 9. For execution, we need to activate caspase 3, 6 and 7. Once it is activated, it causes apoptosis and cell death. Now, apoptosis is not always physiological. It can be physiological as well as pathological. In physiological, for example, you would have seen in babies in embryogenesis or organogenesis, there is some loss of cell in order to produce more mature tissues. So that process is apoptosis. But the important example of pathological apoptosis is viral hepatitis. In the viral hepatitis, the cells of the liver which are infected are being killed by the body itself. This produces Councilman bodies. Now remember, Councilman bodies is a part of apoptosis. And necroptosis. Necroptosis is necrosis plus apoptosis. Since there is necrosis, there is inflammation present. But how is this different from apoptosis? What is the difference between apoptosis and necroptosis? In apoptosis, there was caspase dependent programmed cell death. But in necroptosis, it's caspase independent programmed cell death. Just like apoptosis, necroptosis can be physiological or pathological. The physiological example is growth plate formation. You would have seen the growth plate in the bones. Then pathological example is steatohepatitis. Then pyroptosis. With the word pyro, you can see that there is fever present. Now, how is this occurring? Let's see in a way in which questions can be asked. Usually, a pathogen like Salmonella or Shigella enters your body. This activates caspase 1 and 11. This in turn causes cell death. This is pyroptosis. Just remember for MCQ questions. Pyroptosis involves caspase 1 and 11. Then let's see the last one, anoikis. Anoikis is usually occurring when there is loss of cell's natural environment. For example, some cells are better survived in the alkali environment, but when they are exposed to acidic environment, there can be cell death. Just like that, when the cell loses its natural environment, there can be cell death. This is anoikis. Now that's about cell death and how to tackle the questions asked in this topic. Thank you, doctors.